COVID-19 Guideline. How parents with kids are navigating the new mask guidance. Whether we're ready for it or not, new guidance from the Centers for Disease Control and Prevention, CDC, has swiftly cleared the path to normalcy in the United States. The May 13, 2021 update says it's safe for fully vaccinated people to stop wearing masks both indoors and outdoors, regardless of crowd size. But the CDC makes no mention of how maskless individuals will prove their vaccination status, an omission some experts feel could put children at risk. This video brought to you by HealthyRN Ways channel that talks about the COVID-19 pandemic, video posting every Monday and Thursday. To see my other videos, see the link at the end card of this video. The American Academy of Pediatrics, AAP, has since clarified that kids under 12 should continue to wear masks in most situations that involve people from outside their household. Children under 2 are not expected to wear a mask. Kids under 12 are likely still months away from being eligible for a COVID-19 vaccine. They are still at risk for the disease, albeit low risk, even as the adults and adolescents in their lives begin to return to normal. There is plenty of uncertainty and uneasiness about how to handle this mixed vaccination status, especially since states, cities, businesses, and school systems are free to implement the CDC mask guidance differently. How do parents feel about their kids coexisting with a maskless society? The answer depends a lot on age, location and conditions. Mask up for infants. As a mom to a 1-year-old, I am not comfortable with my daughter being around maskless adults or kids. My daughter is too young to be vaccinated, and I do not feel that enough people have been vaccinated to create herd immunity. She is relying on the honor system to ensure that only those who have been vaccinated remove their masks in public, which unfortunately, in this politically charged climate, is not reliable. But it's not just unvaccinated adults who pose a risk. Kids, especially, do not socially distance, and they are more likely to be asymptomatic carriers of the virus. This creates a huge issue if they are running around stores unmasked. Other kids under age 2 are fine since they can't wear masks, but I am not comfortable with my son being around maskless people over age 2. More leniency for older kids. Some parents are not yet comfortable with their 10 and 12-year-old being around people who don't wear masks, unless they are sure the adults are vaccinated and small groups of close family or friends. Some are slightly more comfortable with his kids, ages 14, 12, and 8, being around other maskless kids or adults, but others older too just got their first shot. I'm more comfortable with my 2 oldest, but mostly okay with kids being around maskless people since kids have been handling COVID-19 infections really well. I've had 1 child over the course of a year who was hospitalized due to COVID. What is Misc? Multisystem inflammatory syndrome in children, Misc, is a condition that causes severe inflammation in vital organs such as the heart, lungs, kidneys, brain, and more. According to AAP data from April 21, 2021, kids have accounted for only 13.8% of COVID-19 cases in the United States. Fewer than 2% of all pediatric COVID-19 cases resulted in hospitalization. Some parents probably encourage his children to keep masks on in more crowded indoor locations, like a mall. Personally, I am starting to feel more comfortable not wearing a mask outside of work, like eating at a restaurant. Even in New York City, where only 40% of residents are fully vaccinated, has a similar take on mask wearing. I am extremely comfortable with my daughter, 6, being maskless around maskless adults, regardless of their vaccination status. I have not been wearing a mask outdoors since the beginning of the pandemic unless I am in close contact with people. Make the decision that's right for your family. Decisions about mask wearing are extremely personal and situational, even for physicians. It's important to remember that the guidelines are just that, guidelines. If you are fully vaccinated and want to continue to wear a mask out of an abundance of caution, there is no reason not to. I will continue to wear a mask, even though I am vaccinated, to protect those around me in the off chance that I am infected and am asymptomatic. What mask mandate changes mean for kids? When the CDC updated its COVID-19 guidance to say that fully vaccinated people no longer need to wear a face mask in most situations, life is starting to feel a little more back to normal. While fully vaccinated adults are closer to a life without social distancing, masks, and the fear of COVID-19, those under the age of 12 are left out. The future of an approved COVID-19 vaccine for kids remains hazy, though clinical trials for the Pfizer-BioNTech vaccine in young children are currently underway. For the time being, experts recommend that kids from age 2 to 11 continue to wear face masks in most situations. Navigating the at-odds guidance will be tricky for families of mixed vaccination status. Here's what parents need to know. When should kids mask up? Children under the age of 12 should continue to wear face masks in most situations. The statement stipulated that while children should still engage in their school and community activities like sports or religious services, they should continue to wear masks indoors if they are around unvaccinated people. They are with people who do not live with them. Kids can go without masks outdoors if they are with family members, such as going for a bike ride or walk. They are at a small gathering with fully vaccinated family and friends. They are taking part in activities that provide plenty of social distance, such as golf or singles tennis. Parents know that they need to keep their children safe until COVID-19 vaccines are available, but that doesn't mean it's easy to explain to kids that they need to keep wearing a face mask when the rest of the world is finally taking theirs off. For parents, setting a good example could be key to keeping kids in masks until they can be vaccinated. That said, I admit that it might be challenging. It can be a hard sell to children that may be the only people in the household that have to continue to wear masks. One thing that families can consider is that parents and older children can continue to model good mask behavior to help younger children understand and continue to stay safe. We can't expect our children to be better than we are. Even as we encourage them to keep their masks on, we need to build in breaks when necessary. Talking with children about the importance of keeping others safe can also help encourage them to stay the course and keep their masks on. Each family should make an individual plan to keep their family safe, and kids know what to expect. With more retailers lifting mask restrictions and relying on the honor system for requiring masks for non-vaccinated people, kids, and adults, for that matter, are likely to have questions about the new rules. It might help alleviate some of the confusion if families stay masked up together until the youngest members are fully vaccinated. For summer fun, transmission rates matter, as children go off to take part in their summer activities. At places like summer camps and other programs will have to consider risk factors like community transmission rates when deciding whether to require masks outside. There's not one single best answer here. In an area where there's a high rate of transmission, it's possible that they'll continue to recommend wearing masks even for outdoor activity. Each group will have to make decisions that are best for their local area. Give kids a break. The necessity of face masks for children, it's important for parents to find ways to let their kids be kids. Adults aren't perfect mask wearers either. We can't expect our children to be better than we are. Even as we encourage them to keep their masks on, we need to build in breaks when necessary. It can be done safely. Until children can be fully vaccinated against COVID-19, face masks will continue to be an important tool for keeping everyone safe. That said, with mask requirements dropping for vaccinated people, families might find it challenging to convince their kids to keep their masks on. If your family is of mixed vaccination status, you can limit confusion and encourage your kids to think of others by continuing to mask up with them until vaccines are approved. Updated CDC guidance says fully vaccinated people do not need to wear a mask in any setting, except while traveling. The guidelines have caused confusion about whether unvaccinated kids still need to wear a mask when the rest of the family doesn't have to. Parents with kids are mixed in their reactions to the guidelines. They're also divided on whether or not they'll let their kids be around people who don't wear masks. The update will not change things for a large population of unvaccinated individuals. For now, kids should continue wearing masks in most settings. Families may decide to continue wearing masks to encourage younger family members to do so. Please like, share, and subscribe to my channel. Thank you for watching. See you on my next video. Ma salama.